Hi, this is Dr. Katina, and this is the video tutorial for tab 6, Intervention Componentry I, using my paper here, just as a reminder of what the title was, Randomized Clinical Trial. This is going to be very much in the methods section of the paper. So although really you have to kind of dive through all of the paper to find some of these things. Was the program called a prehabilitation program? And the answer I would say is no, although it is, and it's not in the title. They call their group a prehabilitation group, but they really, they do call it a prehabilitation program, but not really. So I decided to say no, and I said that they called it preoperative high intensity interval training. Like this was their HIT protocol, literally HIT, HIIT, and it was their preoperative high intensity interval training. So, and it was prior to surgery, and it was very clear that it was prior to surgery. They had that outlined in this portion prior to surgery. And in their abstract, they say prior to surgery, candidates for lung cancer resection were assigned to those two groups. And then they talk about how they've used this protocol before for a different patient population. It was in cardiac rehabilitation, and it was feasible and safe in deconditioned patients with chronic heart disease. And then it says here pretty clearly that it was prior to surgery, because they talk about the typical number of weeks that what that window is prior to surgery. And then it's about 2 to 3 weeks that they have. So like, as I said here, for logistics reasons, between decision for resection and then it's the surgery, they have about 2 to 3 weeks. So I know that it was prior to surgery. And the reason why I'm going on about this is because in some papers, it's very much on the line. And it seems like maybe was there a tiny bit done before, especially in the neoadjuvant chemo groups, because neoadjuvant, is chemo prior to anything else. So, but that still might be a 2 or 3 week window. Could be. There's a lot of testing that needs to be done. But my point is that a lot of the papers, you really have to kind of dig in there and actually see. If for some reason it really seems like your intervention was not prior to, in any way, shape, or form, like nothing was done prior to chemo, surgery, radiation, please contact me or email me at katinak@duq.edu. So it's KUTINAK@duq.edu, and let me know, and we can look again at your paper, because I don't want you again to waste any time on a paper that might have slipped through the cracks. So it was prior to surgery. Again, you can clarify there. In terms of intervention exercise components, for this study, in terms of their intervention, they describe their high intensity interval training, and they did measurements at first to kind of see where the patient's max VO2 was, and sort of to set their range for their intensity level and how hard they could work, and to maintain their comfort, which also helped to maintain their adherence. So really their intervention was using this upright electromagnetic cycle ergometer. So they were biking. There really wasn't anything else that was involved. It was this intensity interval training on this bike. They said they had 15 seconds of sprints, and then they had resting, and then they had 4 minutes in between. So it was just the ergometer. There were really no other interventional components. And if, for example, they also did walking, you could put it there, and then you can just add a row, and you could say TheraBands, whichever it is, you can add rows nicely there. It's nice and easy to do. Were there any web-based options? Again, the pop-ups are to give an example or to explain what we mean by that. So, for example, in my study, it is not apparent in any way that the participants had any access to an internet or web-based instructions, that they don't describe that at all. There was no login for the next week's or next day's amount. It doesn't appear that they measured adherence that way. There was no kind of like group chat for support. So there doesn't seem like there was any remote option, that they did the spiking under the supervision of the therapist. But also, in terms of other versions of support, I did make note of here that they really verbally encouraged the patients during their exercise sessions. They said, during the high intensity interval training, the patients were verbally encouraged, because this can make a big difference. And sometimes that needs to be controlled for, because if the group that was in the control group or the current care, if they didn't get any verbal encouragement during whatever their usual care is, but these people did, sometimes that can make a difference. So I'm glad to see that they noted that. But so I did say that was a version of support. For what clinical specialty was the leading interventionist, some are not specified. There are ones where they don't really say who was supervising, or the patient might have been independent. And so for some of the time, the patient's supervising. But for this one, it says very clearly that an experienced respiratory physiotherapist supervised their personalized sessions. It was 1 to 3 patients at a time, 3 times a week. So I said respiratory therapist. Other isn't appropriate there. Respiratory therapist is fine. In terms of other disciplines, I did not see of any besides that. So I said not specified, but I could take that out. Let's see what other options there are. I could leave it blank, but they just didn't say if anybody else was there. I'm just going to say not specified. And if you answered other above, please explain here. You don't need to explain not specified. That can be taken out. Okay, I'm going to save there and meet you on the next page.